Thank you, Mr. Chairman, and thank you, Madam Secretary, for coming today. And this probably could have tied in with the last hearing we had. Being from Lancaster County, I think our county has, we're probably in the top 5 counties in the entire country when it comes to nursing and residential care facilities. And under the governor's budget proposal, he plans not only to expand the sales tax from 6 to 6.6%, but also expand the list of items subject to taxation to include, the home health care, which I know that he's really promoting, and which is the way society is going today. I understand that, as well as the nursing and residential care facilities, personal care services, and other ambulatory health care services. And I guess I just think, for me, I think there's somewhat of a disconnect. As I said, the governor's pushing for home health care, and yet I don't quite understand why we would be doing this and then proposing this, expansion of the sales tax to be included in that. I'd like to get your thoughts on that. And then I guess that's the first question. And second would be, of course, people talk about the Medicaid costs and the expansion of that program. And I guess what I'm thinking is the nursing homes are probably going to have to be forced to increase costs in Medicaid when private pay seniors are spending their savings more quickly and they become eligible for state-funded services sooner. And I will say, and I mentioned today, I still do a little bit of tax work, and it's amazing when I see somebody in facilities in Lancaster County, and let's say they're in skilled care, we're spending $120,000 a year, for health care, and now we're going to add sales tax on top of that. And I have a friend of mine who completely worked his whole life, had some savings, and was very ill, and died with not much money. And I just wanted to get your thoughts on that, because 6% on these type of health care costs is very significant. 6.6% is very significant on ones we didn't have prior to this. So I just want to get your thoughts and feedback on that.
Sure, I appreciate that. As a taxpayer, certainly I share in the concerns that you just raised, as well as the concerns that your constituents back home have raised. And believe me, when I went home last weekend, I had similar questions posed to me in terms of my supporting of an opportunity for our Commonwealth with the multiple billion-dollar deficit. And what do? For the 2 points in particular, Representative, that you just raised, for the vast majority of folks within our long-term care facilities, more than approximately 75% of the care is paid for by Medicaid and Medicare and Medicaid, which isn't taxable. For those folks who you rightly mentioned are private pay, and that their resources, therefore, are being spent more quickly, perhaps, than they would if they didn't need that level of care. I think that's the best example that, unbeknownst to me, that I would even talk about in great detail today. However, it's an important point to make that if we don't do a better job of ensuring that not just me as I sit here or you as you stand there and all of those who fill this room understand what long-term care is, what it means, what it costs, what opportunities there are to offset that. What about long-term care insurance? How do you work with your estate planner in order to ensure that you're taking advantage of, some healthcare opportunities that are available so that you don't have to spend your resources all in one full shot, on a monthly rate in a nursing home, if, heaven forbid, you need that level of care. But that's part of the problem. Most of us don't think about it till the crisis hits, and then it's faced, it's smack in our face that we're faced with this rather large bill because we need nursing home care.
Well, like I said, it's a large bill. And as I said, with Lancaster County, a lot of people want to retire to our county, and they do. And I see it even in my own district. We have a couple of, facilities where people like to retire to. Sure. And I just am saying I get the home health care. I understand the concept, but I'm just saying that once again, and it was an issue we talked about in the prior hearing, the sales tax increase. I just think it's something that needs to be looked at. So, but thank you for your time. Thank you, Mr. Chairman.